Hi, my name is Dr. Rudra Mohan and through the Oral Health channel today we are going to be talking about the treatment of OSMF surgically with the help of a nasolabial flap. Let's start. So today I am going to be talking about a surgical option for the treatment of oral submucous fibrosis, which actually happens in most severe cases, which is not getting affected, or there is no effect of any medications, antioxidants, injections, any topical therapy or any sort of intervention which is non-surgical or conservative in its nature, and that's why we have to resort to surgery. So today I'm going to be talking about a nasolabial flap. As the name suggests, we are going to be raising a nasolabial flap, because this is the nasolabial fold through which we raise a flap, and what we do is, this is the procedure. Now, after doing a pre-anesthetic workup, because this procedure has to happen under general anesthesia, it cannot be done under local anesthesia, so it has to be done under general anesthesia. We will first excise the bands. We will first measure the interincisal opening, that is your mouth opening in terms of millimeters, and we will palpate the bands and see it. Once you are down under the in the anesthesia, we will make an incision from the angle of the mouth to the retromolar trigon or the pterygomandibular raphe, which is somewhere behind your last molar, and we will place an incision and we will cut and excise the bands, the fibrotic bands, because of the OSMF. After that, we will do the coronoidectomy. This is your coronoid process here. We will shave a little bit of it off so that it becomes a, it's known as a coronoidectomy, and we will extract the third molars. Now what will happen is, this is the part where we have this is the recipient site which we have prepared. The donor site is basically here. We will make two incision lines which will start from the ala part of your nose all the way to the lower end of your mandible, the lower border, inferior border of the mandible, and we will make two incisions, right? And they will create two wings. One is superior and one is inferior, and they will be joined at the level of the modulus or the corner of the mouth. Now this type of a flap is known as a seagull wing flap because of the shape, and once we undermine the donor tissue and make sure that the flap is separated, we will create a transmucosal tunnel, that means a tunnel through your cheek, and then rotate the flap inside and put it inside out and then stitch it up. Now once this part is done, we will stitch up from the inside, and from the outside we'll have two borders of this fold of skin and we will stitch them together. The good part about this is that it does not leave a scar because of the fold that is present, so the scar is not very much visible. Secondly, you need to understand the most important part about it is that obviously you have to leave the habit. You have to be very motivated to leave the habit. Secondly, your physiotherapy starts essentially from the 5th day, and you have to do it every day as many times as possible, if possible 6 or 7 times, with the help of either a Heister's mouth gag or a Ferguson mouth gag or ice cream sticks, whatever it is, whatever the instructions the physiotherapy requires, you have to do it very diligently, otherwise your treatment outcome will fail. The results of this flap have been very good. Post-year follow-up, the mouth opening has been great, provided, now this is the catch, you need to continue the physiotherapy every day without fail. If you do not do the physiotherapy, essentially you will lose out on the successful outcome of the treatment. So that's it for today. Please like, share and subscribe, and do press the bell icon for important updates. If you want to get in touch with me, here are my social media handles and my WhatsApp number. Kindly do not call me directly as I might be busy with patients. Just drop me a message with your name, your age, your location, and what is your common oral health problem that is causing you problems, and I will get back to you within a couple of days. If you have any queries, apprehensions, insights, comments or suggestions, please feel free to put them in the YouTube comment section. So that's it for today. Thank you.